Hey, what's going on, everybody? It's Dr. Matt from Pinnacle Chiropractic, your local pediatric and family chiropractor here in the Lakewood Ranch, Sarasota, Bradenton, Florida area. And tonight we are having our ADHD sensory anxiety webinar for parents. And so this is a webinar that we like to do on a regular basis, just educating about some of the hidden causes behind these chronic childhood conditions that we're seeing become more and more prevalent, and then some of the science behind chiropractic care, specifically pediatric and neuro-focused chiropractic care, and how we can help these kids. So we really appreciate everybody jumping on tonight for this webinar. We'll try not to take too much of your time, around 30 to 45 minutes for this webinar, and we'll try to get through the content and answer any questions if anybody has any. So with that being said, let's get started. So really the goal for this workshop is to give you guys hope, give you guys answers, and then give you guys some help as well, or some action steps that you can take to getting your child's help. So a little bit first about our office. So we are a pediatric, prenatal, and family chiropractic office here in Sarasota, Bradenton, Florida, and Lakewood Ranch, Florida area. And so when we say we are pediatric focused, that's about 75% of our office. So we see the majority of our patients that come into our office are pediatrics. The majority that we see in our office do have behavioral challenges, anxiety, sensory challenges, autism, ADHD, bedwetting, chronic immune cases. Those are all different types of things that we see in our office in the pediatric population. Another 25% of our office is going to be pregnant women and the family members of the kids that we take care of in our office. So here's just a few of our pictures of some of the kids that we've taken care of that are under care with us, and have experienced great wins underneath our care as well. So if you want to find out more about testimonials and stuff like that, if this is your first time kind of finding out about our office, continue to watch our Facebook page and look for testimonials. You can go back through the photos and our posts, our videos. All of those are going to show different testimonials, different wins of some of the kids under our care that have sensory behavioral anxiety, ADHD type of challenges. So we really call the kind of culmination and the everything coming together the perfect storm of what's really causing these chronic childhood conditions like ADHD, sensory challenges, behavioral challenges, those type of things. So this was really kind of found out and developed by my mentor of listening to mom's stories over and over and over again in his practice. He was realizing that he was hearing very similar things over and over and over again. And so when we talk about the perfect storm coming together, what it really is and what the big kind of take-home point is, the more stress that these kids endure early on in their life during pregnancy while they're developing within the womb in the first couple years of life, the more stress that they endure during those crucial times of brain development, the more it starts to wire their nervous system and their brain into more of this fight or flight stress mode of the nervous system called the sympathetic nervous system. So basically listening to moms, he was hearing these common themes, these common ingredients. So not every one of our kids that we take care of is going to have each and every one of these ingredients, but the more of these ingredients, the more of those early warning signs that nervous system was in that fight or flight mode from an early time. So the first really ingredient, it really starts during pre-pregnancy and pregnancy. So we see a lot of moms that had fertility challenges or issues or challenges getting pregnant. And then we see a lot of high stress during that pregnancy. So that first ingredient is kind of pre-pregnancy and pregnancy. So some of the moms that we've taken the case history on the child, when they were pregnant with this child with the sensory ADHD behavioral struggles, they had a very high stress pregnancy. So it could have been marital stress, it could have been work stress, job stress, life stress. moving, those type of things, but they had more stress going on. And when we think about that, mom is sharing blood supply with the developing baby. And so mom's stress hormones being elevated are then shared to that developing baby, which then really starts to wire that nervous system into more of that stress mode or that fight or flight mode. And so that's the first kind of ingredient. The second ingredient is really stress during the labor and delivery process. And a lot of times that stress is through medical intervention. So things like a C-section delivery, a forceps delivery, a vacuum extraction. It could be a cord wrapped around the neck. So some type of physical stress during that labor delivery process is that second ingredient that we see very common in a lot of the kids that we take care of in their case history. And so the third ingredient is really when some of those warning signs start to show up, the early warning signs that that child's nervous system and brain is in more of this fight or flight mode, more in this stress mode of the nervous system. And so a lot of these children with sensory ADHD struggles and behavioral struggles, anxiety, they were very stressed out, colicky babies. So these were babies that had a lot of reflux, a lot of spit up, or maybe projectile vomiting, just very colicky, very fussy. They were hard to settle, hard to get them to stay asleep for a while. You would have to leave the room so quietly. Otherwise, they might wake up very easily. So that first really kind of early warning sign is these colicky, fussy, refluxy babies. And so a lot of these parents that have colic, refluxy babies, they're being told by the pediatrician that they're going to grow out of these challenges, which they might grow out of those symptoms. But once again, those symptoms are just a warning sign. They're just a warning sign that that nervous system is in more of this stress mode, more of this fight or flight mode. And so what happens is then those stress, colicky babies then become more stressed and constantly sick and challenging toddlers. So these are toddlers that still aren't sleeping very well. Their emotions are all over the place. Obviously, toddlers are going to be more emotional, but a little bit over the top emotions. And then we also see a lot of the times around the toddler years is when we see chronic sickness show up. So in a lot of the kids that we take care of with sensory struggles, ADHD, anxiety, those type of things, they had a lot of ear, nose, throat stuff when they were around that toddler age. So it could be multiple ear infections in a row. It could be a lot of sinus infections, or just always having a runny nose or a stuffy nose. It could be a respiratory cough. Just seems like they were always sick. And mom was always taking them to the pediatrician to give them more antibiotics and try to get them over the hump of all these immune challenges. And so once again, that's just another warning sign that that nervous system, that brain is in more of that stress mode. When we see those kids getting sick over and over and over again, their body's not able to fight it off normally like it should. And then that fifth ingredient, this is where we start to see around the age of 3, 4, 5 is when a lot of the sensory spectrum, ADHD, even anxiety challenges start to show up in these kids. That's when they're going off to school or preschool or daycare, and mom or dad is getting reports back that their child's not behaving, or they're having a lot of anxiety, meltdowns, a lot of challenges in school as well. So that's when those challenges really start to show up. Then we've even taken this a step further of taking care of a lot of preteens and teenagers as we see these same sensory anxiety, ADHD behavioral kids then grow into more exhausted, angry, anxious, depressed teenagers. So once they hit that puberty and kind of teenage years, they're becoming exhausted. Their nervous system's been in this stress mode for so long, really since birth or even before birth within the womb and pregnancy, that nervous system's like, we can't keep this up anymore. So it leads to chronic fatigue, becoming exhausted, just no energy, and then a lot of anxiety and anxiousness and depression is what we see in a lot of the teenagers that we take care of. Once again, these were the sensory kids, ADHD kids at 3, 4, 5, but then when they become teenagers, those symptoms morph and change a little bit more. And then we can even take this another step further into adults, is these same kids insane teenagers then become those burnout, stressed out, anxious, and ADHD adults, the adults that their brain's constantly running a million miles a minute. They're just burnout. Once again, low energy, adrenal fatigue is a common thing that we see in a lot of moms that we take care of. And so all of those things, the underlying issue is that nervous system is stuck in this stress mode. It's stuck in this fight or flight mode. So basically, it's when that stress mode gets stuck on. We'll go over this graphic a little bit later on and talk about those two different modes to our nervous system and our brain. So why we look to the brain and the nervous system is because the function of the nervous system is to perceive the environment and coordinate the behavior of all cells. So especially when we talk about sensory challenges are challenges perceiving the environment, and then it's affecting the behavioral output of that child. So whenever we see a lot of sensory challenges, there are a lot of behavioral, emotional control challenges that are interrelated because that nervous system isn't perceiving its environment through its senses properly, and it's affecting that behavioral output. So why another reason that we look to the nervous system is a lot of the kids that we take care of that have stressed out nervous systems, stressed out brains, it's not just one system that's being affected. Because that nervous system is really the master control system of the body, it's affecting multiple systems of the body and multiple areas of the body. So oftentimes we'll see kids come in with motor delays. So they could be have poor fine motor and gross motor challenges. We could see a lot of kids that have gut GI issues. So it could be constipation, could still be reflux, could just be a lot of inflammation within the gut. We see that. We'll talk about our technology that we use in our office a little bit later on. We can actually see the amount of inflammation in the gut. We see a lot of kids that their immune system is not working properly. These are the chronically sick kids. We see speech can be affected as well when that nervous system isn't working right. So we see plenty of kids that are speech delayed as well, or were speech delayed as the toddler age at 2, 3, 4 years old. Social component of things, we see a lot of the kids that we take care of. The social aspect, they're just a little socially awkward, or they don't know how to interact with their peers properly or kids their age properly. Then obviously 6 and 7, behavioral emotional, we see a ton of kids that have sensory ADHD, anxiety challenges, have a lot of behavioral emotional control challenges. So these are the kids that are 0 to 100. They could be happy one minute and then super angry or sad the next minute, crying, having a big meltdown, a big explosion of emotion. So when that nervous system isn't working properly, it's oftentimes many other systems of the body that are affected. And so one of the cool things about our care, and we really say it's a foundational piece to taking care of a lot of these kids in a natural way, because once we get that brain nervous system working properly, we can see many of these other systems and areas of the body start to work better. So we see improvements in a lot of those different areas in the kids under our care on a very regular, very consistent basis. So we like to bring a lot of science into these workshops because really there's a lot of awesome research out there in these fields. And so Harvard is actually doing a study right now, Harvard University, on the developing child. And so they're studying how stress affects brain development, essentially. And so the big take-home point to this slide is that toxic stress, any type of stress that's basically over and above the normal stress load, weakens the architecture of the developing brain, which then can lead to lifelong problems in learning, behavioral, physical, and mental health. So once again, that stress early on, this Harvard University study is actually confirming what we pretty much already know, is that stress very early on in a child's life can affect the way that brain and nervous system develops. And then if it gets stuck in that stress mode, it can lead to learning challenges, behavioral, emotional control challenges, and physical and mental health challenges, whether it's gross motor skills, fine motor skills, and then obviously the anxiety piece fits into that mental health as well. And so basically, this is kind of a couple different pictures here of some of the studies. But basically, if you look at this graph on the left there, this is basically brain development. And so when that brain development happens the most rapidly is really the first year of life and the first couple years of life. So when we're talking about when that stress to the brain is the most impactful, it's within those first couple years of life. That first year of life, our vision, hearing, sensory pathways are developing most rapidly, our language is developing the most rapidly, and even our higher cognitive function towards the end of our first year of life are developing very rapidly as well. So if we encounter a large amount of stress in those years or those times of very quick brain development, that's what's really going to start to affect the way that brain is developing and working. And so the right picture there shows basically how toxic stress damages the neuronal connections. And so especially the prefrontal cortex and the hippocampus are the two main areas of the brain where we see that toxic stress really start to affect the brain the most. So we always get asked this a lot, is kind of what is or how much care is somebody going to require? And that really depends on multiple factors. The first one is really how much stress, how can we find, how many of those early warning signs, ingredients of stress did that child have early on in their life? And then when did that stress occur? How early did that stress start, essentially? So the longer it's been there, the older the child, the more care it's going to require. The younger the child, if we can get to kids really under the age of 7, 8, 9, even 10 years old, we can see the quickest amount of changes and the best amount of changes. The older the child gets, the longer that brain has started to kind of hardwire and develop into that more chronic stress mode. And so it's going to take a little bit more time to really get that brain out of that chronically stressed mode. So this is a quote by one of my mentors, Dr. Tony Ebel, that really puts everything kind of together about the spine, connecting the spine, the bones, to the actual nervous system. So a lot of people think chiropractors, well, you're just bone doctors or you're just pain doctors, which most traditional chiropractors are, but chiropractors that focus on the brain, the nervous system, we look at that intimate relationship between the spine and that nervous system. So he said this: the spine serves as far more than a bunch of ligaments and bones. It's a living, breathing, neurological communication superhighway that is vitally important in brain to body and back again, communication, coordination, and control of every cell, tissue, system of biological and physiological system. So basically what that means is that nervous system in that spine is an information highway. If we look at the graphic on the right there, we've got our brain up top connected to that spinal cord that goes down through the middle of the spine. Well, what happens is that brain is constantly sending signals through that spine and spinal cord to the rest of the body, and then the body is sending signals back to the brain through that spine and spinal cord. So literally all of your signals of your body have to travel through the spine and through the spinal cord. And the next part of this workshop, we're really going to dive into the science behind how the spine starts to affect the brain and the nervous system. So this is for all of you science nerds out there. You'll really like this. Myself being very analytical, I love learning about the science and how and why things work and how we get results that we do, essentially. So once again, the underlying theme to what the underlying causes of these childhood chronic conditions are is it's when that stress gets stuck on. It's when that stress mode of the nervous system becomes in that stuck on mode. So the next part is we're going to, like I said, dive into the science behind how the spine affects the nervous system and the brain. And so we're going to go over a couple fancy D words and break them down into more simplistic terms for you guys. So the first thing, and this is really a chain of reaction that happens, the first thing has to happen for the second thing, for the third thing, and so on to happen. So the first thing that happens that sets all of this in motion is what's called dyskinesia. It's basically when we have a misalignment fixation of the spine. It's when that spine becomes kinked, jammed, stuck, bent, isn't moving properly, and it's lost its proper alignment as well. So when does this dyskinesia occur? And this is really what we call the moonwalking bear. It's where we see, I would say, close to 80 to 90% of the cases that we take care of have this ingredient. It's birth intervention. So this is basically what a normal C-section delivery looks like. So look at how much excessive force is being used to the head and neck as you're watching this video. So basically getting baby's head and neck out, that was quite a bit of force, but now watch the OB's hands lifting this baby out by the head and neck. So they're twisting it right, bending it right, left, and then lifting it out. And look at the ending there. That doctor is holding on to baby's head and neck with nobody else supporting the body. They're using the weight of the head and the neck, and the weight of the body is then creating a counter force against that force of the doctor holding that head and neck. What's the first thing that we protect on a newborn baby? I have 2 kids myself, and I know the first thing that I was very, very extra careful of was that head and neck area. That's the first thing that we protect on a newborn baby, because they don't have the developed musculature yet to protect that area. And so we're really going to talk about why that upper neck especially is very, very important neurologically in the next few slides. But the big take home to this is a normal C-section delivery uses a lot of physical force to the upper neck and the head area of a newborn baby. That's where that misalignment fixation in the spine is starting in a lot of these kids. So the whole point kind of that video is it's easy to miss something if you're not looking for it. A lot of people just think they're going in for a routine C-section. There's nothing to it because it's very, very common in our society, but it's not normal. It's using a lot of excessive force to that head and neck area. And so these are cesarean rates over the years, essentially back in like the early 2000s, about 1 in 5 births, about 20% of births were cesareans. And now, this was even 2012, so I'd like to see the updated stat, but essentially 1 in 3 births now are via cesarean in our country, in our culture. There's other countries out there that have much lower cesarean rates. Our country, we have a very high rate of cesareans. And so there's other countries out there like Brazil, I think, has over a 50% cesarean rate. But essentially, these kids being brought in by cesareans, and I'm not saying that they are not needed because they can save mom and baby's lives, but they do have side effects as well because they're using such excessive force to that head and neck area. And that's what we'll talk about pretty soon here. So this was a study done by a group of osteopaths. What they did was measure for that dyskinesia, that misalignment fixation of the spine, with 100 healthy newborns. So these were non-NICU babies and newborns. They were healthy APGAR scores, good APGAR scores at birth. And they were all different types of births, some natural vaginal deliveries, some C-sections, some forceps, some vacuum extractions. And what they found was 99 out of 100 of those newborn babies had some level of misalignment fixation of the spine. So even just a normal vaginal delivery can still be physically stressful to a newborn baby. They're having to squeeze through that birth canal and twist and contort their body to come out. And so that can, in and of itself, just a vaginal delivery, be physically stressful. But the big kicker to this study was that the more birth interventions used, the births with C-section, forceps, vacuum extractions, the greater the severity of that misalignment and fixation of the spine was. And when we talk about that misalignment and fixation of the spine, the greater the severity of that, the more neurological implications that will happen down the road as a result to that. So the next chain of reaction, the next thing that happens in that chain of reaction is called disafferentation. This is where the brain starts to be affected. So disafferentation is essentially abnormal neural input into the brain or abnormal sensory input to the brain. So that misalignment fixation in the spine, what it does is it starts to alter the input to the brain from the spine, from the spinal cord. And so we have what are called proprioceptors and nociceptors within our spine. And so we'll break down both of those. So proprioception, it's basically the perception of movement. And so a big percentage of movement stimulation or proprioception to the brain, which is a vital nutrient for the developing brain. It's a calming, it has a calming effect on the brain. It comes from the spine, especially the upper neck. About 1/3 of that total proprioception, that good calming input, comes from that upper neck area there. And nociception is just the opposite. It's basically the perception of stress. Nociception is the sensory nervous system's response to certain harmful or potentially harmful stimuli, which can be mechanical, chemical, or thermal. And so why this is very important is when we have that big misalignment fixation in the spine, what it does is it decreases or shuts down that proprioception, that good calming input to the brain, and it replaces it with this stressful nociceptive input to the brain. And so when that proprioception is low, that good input is low, nociception is high, essentially. And so the way I like to describe nociception, it's like this background noise. It's like this crazy heavy metal music in the background. So a lot of the kids that have ADHD struggles and focus, attention, anxiety, or even we have a lot of kids that will tell their parents, I just can't turn off my brain, especially when they're trying to sleep. We see a lot of kids that have sleep struggles because they can't turn their brain off to fall asleep because their brain just keeps running 1,000,000 miles a minute. Well, that brain moving 1,000,000 miles a minute is all this nociceptive input. And so when we go back to the C-section, if we look at that C-section delivery, that remember 1/3 of that proprioceptive good calming input comes from that upper neck alone. When we have that big misalignment fixation of the spine right at the upper neck area, the base of the skull, we're cutting off 1/3 of that good calming input, replacing it with more of that stressful nociceptive input. And so that's really how the spine becoming misaligned and fixated starts to affect the input to the brain, which then leads to the third thing in the chain of reactions, which is dysautonomia. This is basically where our autonomic nervous system, our nervous system that controls everything essentially, it's the way our brain communicates to our body and our body communicates back to the brain, is through this autonomic nervous system. It's where that autonomic nervous system gets stuck in a stress mode. And so you can't be in growth mode and protection mode at the same time. This is why we see so many kids with developmental delays. They're stuck in protection mode. They're not going into growth mode as often as they should. So when we talk about the autonomic nervous system, this graphic pretty much is the perfect graphic for it. So the autonomic nervous system has two modes to it. We have a brake pedal mode. We call it the brake pedal because that's where all the good stuff happens. The rest, relaxation, growth, immune function, sleep. All of that good stuff happens in that brake pedal mode. It's called the parasympathetic mode of the nervous system. Then the opposite mode in red there on the right, we call that the gas pedal mode because that's our sympathetic fight or flight stress mode or protection mode of the nervous system. And when we get in that sympathetic mode, it's like turning on the gas pedal. We like to use the gas versus brake analogy of a car. That sympathetic mode is like go, 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 go. And that brake pedal mode, that parasympathetic mode, is more like rest, relaxation, slow down type of mode. And so what we see is that misalignment fixation in the spine leads to the altered input to the brain, more stressful input, less calming input, which then leads to that autonomic nervous system being stuck in that gas pedal, in that sympathetic stress, fight or flight, protection, survival mode of the nervous system, and they don't go into that rest, relaxation, growth, development mode as often as they should. And so that really leads to the final chain or the final thing in the chain of reactions, and that's called dyskinesis. So dyskinesis is a reversible is the key word here, pathophysiologic state. It's composed of neurophysiologic reactions to various agents and the repercussions of these reactions throughout the organism. The neurophysiologic reactions consist mainly of covert errors in energy expenditure. So the key thing about dyskinesis is it is reversible. It's not permanent. And dyskinesis, to really sum it up, it's abnormal energy output. It's basically the kids that we see going a million miles a minute. They can't slow their bodies down. They're sensory seeking. They want to climb everything. They want to be rough. They want everything touching them. Those are our sensory seekers, and they are experiencing a lot of dyskinesis, which is that abnormal energy output. And so one of the cool things about our office is we actually have scanning technology to measure the nervous system. We can actually see how the nervous system is functioning in each child. So this is one of the pieces that we look at to see how much care each child is going to require as well. So if we talk about our scans, we can do a couple different scans on these kids. So the first scan that we do, it's called a rolling thermal scan. So this rolls up the back, and what it does is it senses heat or inflammation along the spine. So this will literally tell us where exactly the problem areas are within the brain, within the nervous system, within the spine. The second scan will really measure that dyskinesis. It will measure all of the muscular tension along the spine. We know more tension essentially within the spine, the more that child or that adult or that pregnant woman is in this fight or flight mode or fight or flight state. And so when I describe tension, it's really stored stress. If we think about us as adults, if we have a lot of different pain or issues or stuff like that, where we just feel tight all the time, a lot of women, it's in their neck and shoulders. That's where you hold your stress. A lot of women are aware of that. Well, the same thing goes with kids as well. They hold their stress as tension within their spine as well. So that second scan tells us really how much tension they have within their spine. And then it also tells us how much of that input to the brain do they have. So we see a lot of the kids that we take care of have 1.5, 2 times the amount of input to their brain than they really should have. And so those are the two biggest scans we use. Sometimes we'll run what's called heart rate variability, a third scan. That will actually tell us how well their body is adapting to their current stress load. It will tell us if they're currently in more of a fight or flight stress mode, how much energy reserves. This is a very helpful scan for a lot of our teenagers because it will tell us how fatigued, how much energy does their nervous system actually have. And so we talked about kind of what the scans measure. So on the right there, that's what the scanning equipment looks like. It's totally non-invasive. There's no harmful radiation or anything like that that's emitted from it. And there's nothing harmful or invasive about the scans. They're very, very simple scans that we run. And so one of the other big questions that we get is, how long is it going to take? And that really depends on the child, their symptoms, how much stress they incurred early on in their life, and then the age of the child as well. So typically, this is a graph, once again, by Harvard University, and they were showing the brain's ability to change versus the amount of effort that change requires. What they found was less effort, less time, the younger the child, but as they get older and older, the more effort it's going to take, or the more care it's going to take, and the longer it's going to take for long-term changes to really happen. Whenever I talk to parents, a lot of other chiropractors, they might, recommend a few visits here and there. With our care, we are recommending more intensive care, usually 3 times a week, especially for sensory ADHD anxiety challenges in the beginning, to get that brain nervous system leveled out, essentially. And so the older the child, the longer it can take for those symptoms to really change. Usually the younger kids, they're going to see a lot quicker symptomatic changes. So going to other chiropractors that aren't necessarily trained or specialized in this work, they might recommend a few visits here and there, and you might see some symptomatic changes, but they're not going to be long-term symptomatic changes. The brain, the nervous system needs time and repetition to make a long-term change within it. And that's what Harvard University basically confirms. It's going to take time and repetition to make that long-term change that we want. If you're just getting a few adjustments here and there, you might see some short-term changes, but things are just going to go right back to the way they were if you don't create that long-term change within that brain, within that nervous system. And that's something that we are really the best in the area doing. We constantly train on taking care of these kids. We train with our mentor, Dr. Tony Ebel, who I quoted in this, who developed a lot of this presentation. We train with him and his office, his staff of 4 doctors on a weekly basis through Zoom meetings, webinars. We went a couple of weeks ago to an in-person training. So we're constantly training on these things and getting better on these things. And then we have a wealth of knowledge and experience when it comes to taking care of kids with these cases. So we know exactly a rough estimate of how many visits it's going to take for each child when they come in based on what we see or hear in their case history and see on their scans as well. So basically the action steps for tonight is keep asking questions. A lot of you moms or dads that are on here, you're probably warrior moms and dads. You're constantly looking for answers and solutions for your child. So keep asking questions, keep finding answers. Reduce and remove the 3 types of stress. So those are going to be thoughts, traumas, and toxins. Thoughts are emotional stress. Toxins are chemical stress. And traumas are more of the physical stressors. So limiting those and removing those will definitely help. And then the last and final action step is really just finding out if we can help your son or daughter or your child. So for getting on this webinar, we offer a little bit of a discounted rate in our office for the first few visits. So basically the process for finding out if we can help your son or daughter is a 3-step process. So this first 3 visits basically includes a phone consultation. This is where we'll take a case history, find out about the pregnancy, the labor delivery, any of those early warning signs that we talked about early on. And then the second part is coming to our office. We'll be doing the scans and examination evaluation visits. So we'll be doing those scans that we talked about using our technology. And then the third visit is what we call our report of findings visit. This is where we'll go over everything in detail. We'll go over all the scans, what we found with the scans, our recommendations for care, how many visits, how long is it going to take. We'll go over some of our other recommendations, kind of what to expect with care as we go through it. We'll go over everything that you need to know at that third visit, that report of findings visit. So typically in our office, it's $250 for all 3 of these combined. For the webinar, we're offering this at half off, basically. For $125, you can get 1 child scan. Or because we see a lot of full families in our office, we see a lot of families of 3, 4, 5, even up to 6 in our office. For just $200 total, you can get your entire family scanned and evaluated, their nervous systems evaluated. So especially if your other children don't have any big challenges, sometimes we can start them at a less frequency, or you as adults, if you don't have a lot of big chronic standing challenges, we can start them at a less frequency. About once a week is typically what we recommend for wellness care. But if there are more chronic issues, it does require usually that 3 times a week. So if you want to take advantage of this offer, we invite you to go to our website. You can fill out the request appointment or contact us form on there, www.pinnaclebradenton.com. You can call our office, 941-822-8828. You'll be able to talk to Jen or Aaliyah, and they'll be able to set up those appointments for you. Just mention that you watched the webinar and you'd like to get that $125 special or the $200 special for your entire family. So I know this is a lot of information in a short amount of time, so this is going to be posted on our Facebook, so don't be afraid to go back and watch it over again, because each time you watch it, you're going to gain other little different nuggets and new pieces of information through it. So it will be saved on our Facebook page. You'll be able to go back and rewatch it. And then if you're new to following us, we invite you to really like our Facebook page, follow it, and keep up with all of our testimonials, our wins, our office pictures, all of that, so you'll be able to get to know us a little bit better. And then when you're ready to make the jump, you can go ahead and give our office a call. So really appreciate everybody for hopping on here tonight with us. And we really hope you enjoyed this webinar and this presentation. And so be sure to, like I said, keep an eye on our Facebook page. We're constantly updating new educational information, testimonials, stuff like that. So thank you once again, guys. this is it for now. As always, guys, I'm Dr. Matt, and be well.